Hi guys, welcome to another episode of my ongoing dental journey. If you've been following the series, you know I'm trying to get my malocclusion fixed. So this is an appointment I'm really looking forward to. I've had the initial consult now with Dr. Erwin at Proud Smile, which is where I'm going now to get this fixed. Today we're going to be locking in a plan, so that's going to be fantastic. I imagine I might be offered a couple of different price points, I'm not sure. I think I'm probably going to be going with a comprehensive plan, but it'll be really good because now I'll see the actual steps involved. I think I'll have some idea of how many Invisalign trays, I think they're called, that they'll be needing to order. So expansion, if you did watch the other video, is my most urgent issue, to get my arches expanded. So hopefully Invisalign will just do the trick, but I might need expanders along the way as well. But I'm really looking forward to it. And if you watch the last one, you'll know that I spoke briefly about the benefits of getting your malocclusion fixed, including being able to clean your teeth better, improved function, so you can obviously chew your food better, but it can also affect your speech if you've got malocclusion, and also hopefully prevent long-term damage on your teeth, like uneven wear and tear, and hopefully prevent cracked teeth as well. But another surprising benefit I learned last week was it can even affect your breathing because of the position of your tongue in your mouth. So that's quite a big health benefit, I think, just right there as a good reason to get your malocclusion fixed. So I'm excited about today. Today feels like I'm really starting this journey finally. So let's get your shoes on and let's go. Come on. Okay, here we are at Proud Smile in Pacific Fair. Looking forward to seeing what my plan is going to look like. Oh, it's lovely in here. It's so nice and cool. There's a little bit of a rush to get here. Traffic, the Gold Coast traffic, is not time friendly. I was very impressed the first time I came here to Proud Smile at Pacific Fair. When you fill out the form as a new patient, you can tick or nominate your favourite Netflix show that you can watch while you're having work done. So this one's on the screen, which is not ideal. This one is working on a really interesting hobby. They're loom band bracelets. Hello, and here's the man behind me. Thank you. So this is Spencer, and this is my daughter Amity. All right, I've got the kids with me today, so this is fun. I'm going to get your bag, and we'll get you up. Up. That's right. You need a strong back when you're handling a toddler. Yeah. Like, he's my weight bearing exercise.
So last time we were talking about the teeth, and one of the biggest things that we spoke about was expansion, because at the moment you have very narrow arches, which then I think was causing you to bite on your tongue, and there's not a lot of space for your tongue actually.
I always bite my tongue, like multiple times a week, or like even daily probably, inside of my cheek, lip, tongue.
Okay. Yeah. So so I think for you the biggest thing is expansion, which means moving your back teeth outwards and broaden your arches, because they're narrow at the moment. That will then hopefully improve with the tongue biting and all that sort of thing. There is a bit of an unpredictable component about that, because we don't know how your tongue is going to deal with it. But obviously,
knowing me, probably not very well.
But if we have more space, then we would think that things can only get better. So at the moment, that's where you are. If we look at your top teeth.
Do you know, I can actually see that on the scan, that the teeth are coming in.
It's like,
And
if you look at this scan, you can see how sort of narrow it is like that. So it's almost like in a V shape. Usually we want more of a U shape, which is this kind of thing.
Oh, right.
So this is what we're planning. So
the soft tissue, that's one thing I wasn't really clear about. You're actually hoping to move some of this soft tissue, the palate.
yeah, everything, once the bone moves, the teeth move, the bone moves with it, and then the soft tissues follow that. So everything just follows the movement.
Oh, right. So you really are actually reshaping the mouth.
We can reshape. Obviously, as adults, there's a little bit of limitations as to how much we can reshape.
Yeah.
Had this been done when you were a child, then we would have been able to do a lot more.
Yeah.
But I think it will be sufficient for your case. So this is where you are now, and this is where we should get to the final end result. And then on the bottom, we've got a similar situation. There's a lot of crowding.
Yeah. Yeah, I noticed that with the floss. The floss breaks a lot when I'm trying to floss between.
And then we're also doing some expansion there. The bottom is not so bad as the top, but still we can get some alignment there. Looking from the front, we can go from here to here.
Wow.
So you get more of a flat surface.
Yeah.
And then on the top, looking from the front, this one, we can go from here to here.
Oh, yeah.
You do have a bit of this chip on the front,
I do.
but we can at the end maybe look at doing a little bit of filling on it, or even maybe sometimes just reshaping the teeth to make it flat as well.
Yeah.
How
interesting about the soft tissue. That's answered another question. I learn something new every time I come to. Yeah.
Now you do have a bit of an open bite as well, so you actually don't touch your front teeth. And during the assessment process, I was trying to see if we could close that open bite, but the problem with you is you show a little bit too much gum when you smile.
Oh.
So you are what we call a gummy smile, which, I mean, to some people it's fine, but aesthetically it can sometimes be a little bit not so great.
Yeah.
Because then you would like to see more teeth and less gum. And so to be able to correct the open bite, we would have to actually bring these teeth down, which then results in you showing too much gum. So I've actually chosen to keep it as it is because it's actually not a huge problem. And open bites are actually quite relapsable. Like sometimes you correct it and it goes back. Because it's usually, it can sometimes be related to a habit like tongue thrust and you know, muscle stiffness and things like that. So. And what else? And then if we look at this image here, this is like an approximation of how it could potentially look in your own mouth.
Oh, wow.
This is before and it's after.
Oh wow, yeah. Oh,
so it does,
that does look so different because at the moment I feel like I've got rabbit teeth or something like, you know.
Yeah, at the moment they're quite pronounced at the front.
Yeah, exactly. Those
we
two.
want to broaden it so that we've got more attention towards the back.
Well, that is a lot
and
better.
less of the proclamation at the front. So obviously this is an approximation image, but if we expect it to be close.
It's a lot better than just seeing those two front ones like a rabbit. But what about the chewing though? So with
the chewing will also improve because we are, let's go back on this one. At the back we're going to be improving the contact between the teeth.
Yeah.
See at the moment with your back teeth you have a near cross bite on this tooth here, so it's quite just. Once we move it like this, then what happens is your top teeth pushes your cheek out, and then that way sometimes you don't get the bite, cheek bite.
Cheek bite. Oh, I do.
Which I don't know if you have it, but so yeah, the bite is also expected to be improved with this. And then the good thing about it, it's only coming up to 19 aligners, which pretty much means 19 weeks of treatment.
Oh wow! Okay, that's cool.
Yeah,
so
it's quite fast.
Yeah.
In saying that, I do anticipate we needing more than that towards the end because with Invisalign, whatever we plan on the software doesn't always happen in the mouth. 100% of biology doesn't always follow what we humans.
I know.
You know,
AI
you know that.
Perfect. Yeah.
You know that coming from IVF.
I
so
do.
it may be that with the first go we won't get that.
Yes.
but then we can actually keep adding more aligners.
Yeah.
And the good thing about the moderate package is you actually get unlimited aligners, so we can pretty much keep going. It's kind of like so you just keep going until you get to the result that we want. I think in your case, from experience, I do find that you will most likely need probably 1 or 2 revisions.
Yeah. Okay.
Which means we're going to keep adding aligners there. But even if we're adding, I think we're still looking like probably like a year maximum.
That's great. That's
possibly
really
even
good.
like, well, if everything goes well, even on the first go,
Yeah.
then potentially it could be only 19 weeks. I think it would probably be more like 25, 30, I would say.
I think your estimation is more realistic because as well, wearing them a lot, like I know you can't wear them when you eat, but looking after a toddler, there's a bit of that grazing happening, like just running after him.
Yeah. So now with the aligners, you do need to wear them as much as possible.
Yes,
So you pretty much only remove them to eat and brush your teeth.
I know. So honey, you're going to have to watch that grazing because that's going to be a pain. Like every time I want a snack, it's like, let's take these out.
A lot of our patients say that they end up losing weight because they can't be bothered removing the trays to eat, to snack.
To snack, yeah.
And what else? In your case, we also need some attachments, which are these sort of things here. They are not pink though, they will be tooth colored, but they just help with the movements of the aligners.
Oh, great.
And they get removed at the end of the treatment.
Yeah.
And on the bottom, I have also allowed for some IPR, which is these little numbers here.
Yeah.
You can see how when your teeth get straight, like this is before, when you have crowding, the teeth actually push the gum down. When you then straighten it, the gums don't always go up anymore, and then you end up with this little space between the teeth. We call it black triangle, because it's in the shape of a triangle.
Oh, yeah.
To minimize that, we can do IPR, which is actually trimming a little bit of the tooth on the contact point, and it's only like 0.3 mils, so it's quite small. But that then helps the teeth sort of touch better and reduce the black triangles. But you will still be left with some of it, unfortunately. In saying that, sometimes your gums do move around, so this is obviously the computer trying to predict where your gums are going to be. But sometimes once the treatment is finished, the gums can remodel and close some of those spaces. But you do need to be prepared for possible having these little spaces there. And that's unfortunately because of the crowding, which again, had this been done corrected earlier as a childhood, we wouldn't have this issue now. But I mean, I think it's a small compromise for the bigger picture. Which is,
Well, like a doctor I interviewed said about even heart attacks, the time for prevention might have already passed the best time, but the second best time for prevention and treatment is now.
Yeah, I mean, there's
So
it's never too late
now.
to do
Something
for ourselves, so there's always a benefit. So that's pretty much done. So this is the moderate package. The cost of moderate is 6,500. So it actually came back from the lower brackets from what we discussed.
That's a lot friendlier than
because the bigger one is around almost 8.
I know.
So
that's more doable now.
And then the good thing about the moderate is, like I said, even if you end up needing more aligners, there's no extra cost anymore. So this is a one-off fixed fee.
That's wonderful. What about retainers then? Because like for the rest of your life type thing, once you
you do need night retainers for once the treatment's finished, and ideally for the rest of your life. The good thing about them as well is it actually protects your teeth from acidity, grinding, all sorts of things, and also prevents your teeth from moving again. So there are a lot of other benefits than just being retainers, you know. They're actually a lot more like protection devices as well.
That's great.
So the retainers are, I think it's 300 at top and bottom, but that only happens after the treatment's finished.
Thank you so much. That's really positive. Like that's, you know, because yes, we did have a few rounds of IVF, so budget is a real issue as well. But I think that's something we can definitely manage.
I mean, it's not going to take like, as I think you said, 7. How many did you do? How many IVFs?
33 rounds.
33, okay. It's definitely not going to be 33 rounds on this one. I was thinking more like maybe 2 or 3. And also when I say round, it's not like we're starting from scratch. Like there will be an improvement and then we'll do another improvement on top of that. So it's not like you're going back to the original results.
Yeah, exactly.
So we're always moving forward from one point. So.
Oh, I'm so grateful.
So from here, it's pretty much now. I'll leave it with you. You just let us know when you're ready. For payment, you can actually do payment plans. We can finance up to, I believe, 3 years interest free.
Oh, right.
And deposit free as well if you can't do a deposit.
Yeah.
You just have to apply with the girls in reception.
Thank you
Are you
so
good private
much.
health, by the way?
We do, but not dental.
Yes.
No, and dental's probably the one I really need because I do always need. And what about general dentistry then as well along the way? Like, because I'm Dr. Robin.
Dr. Robin, yeah.
Yeah, he's great. You said that he's the one for.
He can do your general dentistry.
Yeah.
I think he only saw you for.
Just an initial, and I do have dental records. I did have a regular dentist in Surfers Paradise, but he changed, he left, he went and did, I think, along your lines, I think maybe he went to study implants or something like that. So, yeah, I did have a regular one.
Sure. I mean, based on
but
the
also I'm
X-ray,
looking for another regular one.
It seems to be okay. But yeah, from once we get into dental dentistry, you can always go back and see Dr. Erwin as well.
Yeah, I'd like to. I'd be very interested because it's thank
and
you.
it's also in here.
Yeah, exactly. And so, do I come back here then?
Well, you can actually do bundle as well if you prefer.
Yeah.
So if any of the three really.
Yeah. And do I see you again for the?
You see me for the first appointment, which is to place
how to
another
use
time,
it.
and then place to teach you how to use it. And then you usually see me every 6 weeks or so to check on progress and also give you more alignments.
Thank you so very much. I'm very excited to be starting this journey.
Yes, you'll be good.
Yeah, thank you. Thank you for your time.
If you have any questions, you can always email me.
Thank you.
I'm usually pretty good with emails.
Yeah. Thank you so much.
All right, come on through.
Thank you. Oh, good.
Do you want me to initiate anything for you now, or you want to think about it?
No, I'll go with it. Basically, I did know that I wanted to because it is an issue I really do want to get fixed, and it's just been getting worse and worse, and I just when I came here, everyone has been really nice. But yes, I did feel comfortable, and I think it's going to just suit our needs.
It's a bit of a journey, so I think it's important to feel comfortable and have the trust.
Yeah. Thank you very, very much.
Alright, I will see you then in about days.
Thank you so very much. I will see you then. Well, that was so good. So I'm basically on the journey now. So we've accepted the plans. I'm on the moderate plan. We've done all the payments and all that sort of stuff. In about 10 days' time, they'll have those trays in, the first lot of Invisalign trays. And then I'll be seeing Dr. Erwin again, and he'll be able to sort of teach me how to actually use them and all that sort of stuff. But the after result was looking pretty good. And one thing I learned today, I learned something new. Like I said, every time I go and see a dentist, is that the soft tissue palate of your mouth actually does move as well. So everything follows the teeth. So they move the teeth, the bone moves, and then that soft tissue is also going to have some movement there. So that was very interesting to see that. And so yeah, very excited. I'm finally on the way to getting this malocclusion fixed. And then the next step will be actually having the aligners in my hand and then putting them actually in my mouth. So we're on the way.